This week, AI evolved from a passive chatbot into an autonomous clinical assistant. We're officially entering an era of agentic AI, and the practice of medicine will never be the same again. Welcome back to the channel. We are here today to explore the intersection between artificial intelligence, cutting-edge technology, and the future of healthcare. Now, if you've been following technology news over the past 2 to 3 weeks, you already know that the past few weeks has been one of the most explosive and consequential periods of innovation we've seen in the history of artificial intelligence. Now, in a bizarrely synchronized series of events, major giants including OpenAI, Google, Perplexity, Anthropic, Microsoft, and NVIDIA all essentially launched the same exact core concepts, the agentic AI. Now, we've officially moved based on those events past the era of simple text-based chatbots. Today, AI models can dynamically interact with the visual user interfaces, autonomously operate computers, and to execute complex workflows. Right? They conduct multi-step internet research and integrate seamlessly into massive enterprise databases and healthcare records. Now, for the general public out there, this means better coding assistance or cooler web searches. But what does that mean for us as healthcare practitioners or someone enthusiastic about healthcare? For physicians who is battling the legacy electronic health records, the medical researcher drowning in an ocean of clinical trial data, the hospital executives out there who are trying to optimize their operational efficiency, and most importantly, for the patients who is out there waiting for care from us. So today, what I'm trying to do is conducting a comprehensive deep dive into this massive wave of AI announcements. We'll explore code, interactive visual perplexity computer agent. We'll look at Andreev Karpathy's open source auto research tools, as well as Microsoft newly launched Copilot Health. All right. So more importantly, we're going to translate exactly what this breakthrough means for the practice of medicine every day. So let us begin with the most immediate and visually striking change. How will this interact with medical data? Now, the truth is that the launch of interactive visual capabilities for both Anthropic, Claude, and OpenAI ChatGPT is changing up everything we need to know. We've known about this. Now, up until now, when you ask an AI a complex question about medical data, a typical example is you receive a wall of text. It might have been highly accurate, but it was not always intuitive for clinical decision making. Now, these models can dynamically generate interactive charts, graphs, and visual user interfaces component right inside the chart interface. Let's imagine a scenario. Imagine that for a clinical implication for longitudinal patient tracking, right? A primary care physician is treating a complex diabetic patient for multiple comorbidities, can go ahead and impute the massive unstructured CSV of the patient lab results spanning across decades, right? Now, instead of asking the AI to simply summarize the trends in the text, the physician can prompt the AI to build an interactive dashboard correlating the patient's HbA1c levels with their lipid levels, with their weight fluctuations, and medical adherence historically. Instantly, the AI is going to generate a customized interactive scatter plot. The physician can physically hover over specific data point, isolate the variables, as well as visually identify the exact month a new statin or maybe a GLP-1 agonist was introduced. Instantly, they can see how it impacted the patient's overall metabolic profile over time. All right, so now imagine how beautiful that could be. Furthermore on this, this has significant profound implication for the patient's education itself. Health literacy is a persistent and costly challenge in medicine. With interactive visuals, as a surgeon, you can therefore ask AI to generate a 3D or a 2D interactive model of a patient-specific anatomic issue based on their own imaging reports. So let's say you need to explain an impending coronary artery bypass graft to a nervous patient. So the AI can generate a customized visual explanation that the patient can interact with on tablets, making the proposed surgical intervention far easier to comprehend. Now, this move is something that AI can do from a background of analytical tools it has to a frontline communication bridge between the doctor and the patient, providing new tool and a way to communicate with patients much more better than we have done in the past. Now, let's move on to the second massive deployment that we've seen in the past few weeks. Autonomous agents, and Perplexity did something important. They announced the Everything Computer, a tool that allows AI to act as a digital worker, right? Navigating interfaces, clicking buttons, and executing tasks across different applications. In parallel, Andreev Karpathy, of course, one of the founding researchers of OpenAI, released a powerful open source auto research tool. And you want to understand what exactly this means for us and how revolutionary it is in healthcare. We have to look honestly at the administrative and cognitive burden placed on medical professionals today. Currently, you see a highly trained doctor spends hours acting as a glorified data entry clerk. They are forced to click through fragmented electronic medical records. They open separate browsers. Of course, my wife will be like, why are all these tabs open? Right? Now, they're trying to search for up-to-date clinical guidance. They are checking cumbersome insurance portal for prior approval authorization requirements, and then they return to the EMR to write, of course, the clinical note. That's a lot of time wasted clicking from one browser tab to the other. An agentic AI, like the publicity computer model, is designed to automate this entirely. So you could theoretically instruct your secure medical agent, review my chart for my 10 a.m. patients, cross-reference their presenting symptoms with the latest American College of Cardiology guidelines, check if a stress echocardiogram is covered under their current insurance plan, and draft a preliminary order for my review. The agent autonomously on its own is going to navigate the EMR, the medical literature, the payer database, consolidating a 15 minutes workflow into seconds. As beautiful as that is even not all. Now, for medical researchers, Kapati Auto Research Tool is nothing short of a holy grail. So imagine we're conducting a systemic, of course, review or a meta-analysis currently taking months of painstaking, mind-numbing labor. Many people don't like it, right? Researchers must manually review the PubMed, download thousands of PDF files, screen them for inclusion, exclusion criteria, and extract data into spreadsheets. Auto research agents automate the entire pipeline. All right, so you simply give the agent a research question such as, what is the comparative efficacy of GLP-1 agonist versus SGLT2 inhibitors in reducing major adverse CVS events in patients with diabetes? Now, the agent is going to autonomously score the internet, access the necessary database, read, comprehend thousands of clinical journals, isolated clinical trials, filter out poorly designed or irrelevant studies, aggregate hazard ratios, and output for you a highly structured, fully cited clinical review, literature review done. This will accelerate the pace of medical discovery and exponentially allow scientists to focus on forming novel hypotheses rather than data aggregation. All right, so what about the enterprise level integration into massive hospital networks? I mean, some of you might be thinking that right now. So this is this past 2 weeks as well. We did saw that Microsoft explicitly targeted the medical field with the announcement of Copilot Health. Of course, I did see something on ChatGPT Health as well. Now, alongside major updates for Google Gemini in Workspaces and ChatGPT for Excel. Now, Microsoft Copilot Health represents the commercial maturation of an ambient clinical intelligence. We're rapidly moving towards the world where the keyboard and the mouse becomes obsolete in the examination room. Copilot Health acts as an ambient listener during a patient encounter. It securely records the conversation, understands the complex medical dialogue, filters out the small talk about the weather or patient's weekend, instantly generates a highly structured SOAP note, subjective, objective, assessment, and plan. All right, so it identifies the correct billable ICD-10 and CPT codes. And then, of course, goes ahead to pre-populate the EMR for you, for the physician to review. This technology is directly combating the leading cause of physician burnout. Now, the documentation burden. Now, by giving doctors their time back, Copilot Health allows a physician to actually look their patients in the eyes again. It's going to restore that human element of medicine that technology ironically stripped away for 2 decades. Meanwhile, the deep integration of Gemini into Google Doc, the Sheets, and of course Drive alongside GPT into Excel will revolutionize healthcare and its administration as well as epidemiology. Now, hospital administrators, as we have them today, manage vast, complex, incredible data sets, from predictive staffing models based on seasonal flu trends to tracking hospital-acquired infection rates across dozens of different wards. Now, with AI right now, natively embedded into the Excel and the Sheets, an infection control officer can simply just type into that, analyze the data sheets for central and associated bloodstream infections, identify any temporal correlation with nursing staff shortages in the surgical ICU, right? And generate a predictive model for the next quarter. The AI is going to go ahead and write a formula, execute the macros, and build predictive charts autonomously. Right, so we can also go, there are a lot of things that has happened this past 2 weeks. We cannot also ignore the hardware and robotics side of the news this week. where NVIDIA announced Nemotron 3, which of course is focusing on super agentic AI, while robotic companies figure unveil the Helix 2 humanoid robot as well. So NVIDIA is trying to focus on a powerful localized AI model, which is of course is critical to medicine. One of the biggest hurdles to AI adoption in healthcare is data privacy and of course HIPAA compliance. For hospital IT departments is an extremely a careful sector that are hesitant, and rightfully so now. So let's kind of look at some other things here. Health information to third-party class servers and the Montreal paves way for that particular possibilities. All right. So what we're trying to see is that models can run locally or hospital own secure servers, or even directly on a localized diagnostic machine like an EMR scanner or a sequencing machine. Now, this ensures that the patient data never leaves the hospital firewall, completely neutralizing the primary privacy barriers to integrating enterprise-level AI agentic systems. Now, on the physical front, the figure Helix O2 showcase, and I'm sure you must have seen that, shows a rapid advancement of on-board AI. While much of the AI discussion is related to software, hospitals are fundamentally physical environments, so currently facing massive labor shortages. The integration of advanced large language models into the human robot means that we are inching closer to deploying robotic assistants in clinical settings over here in the West. I'm aware that China is trying to do that long time ago. Now, this embodied agent could autonomously manage hospital logistics, transport lab samples, manage pharmacy inventory, and assist nurses with patient transport, of course, turning around patients and alleviating all those severe physical strain on our healthcare workforce. However, while we embrace all this agentic era and all this news, we are mostly confronted with severe ethical and clinical risk involved. The transition from AI as an advisor to AI as an actor changes the liability landscape entirely. First, there is this persistent issue of AI hallucination. Now, when an AI generates an interactive visual chart for a patient lab results, what happens if it hallucinated a data point to make a trend line look smoother? Right? So in a world of text, a vigilant clinician can spot an error, but a beautifully rendered authoritative looking graph can easily bypass a doctor's critical thinking filter. I don't know about you, but for me, yes. This phenomenon is known as automation bias and occurs when humans overly trust highly polished automated systems. If a physician doses insulin or adjusts a clinical medication based on a hallucinated interactive chart, the consequences could be fatal. Right? The second thing we want to look at is the concept of autonomous agents navigating EMRs. It's going to raise a lot of massive security and privacy red flags. If a digital agent is given the credentials to access a patient chart, to cross-reference the payer's database, and send emails, it becomes a prime target for cybersecurity threats. Right? And a compromised medical AI agent could autonomously scrape the entire and, of course, exfiltrate millions of patients' records in minutes. We must establish a robust human-in-the-loop verification protocols. An AI can draft the clinical notes and, of course, tee up the medication orders, but a licensed human physician must always be able to do the final clicks that assigns the charts, signs it off, and execute the order. Finally, in the unresolved question of medical liability, if an auto-research tool, right, aggregates clinical data, but misses critical contraindication hidden in the supplementary appendix of a trial, and of course, a hospital updates its clinical pathway based on that flawed research. Who is liable when a patient is harmed? Now, the software developer, you might say, maybe the physician who trusted the tool or the hospital system. Our current medical malpractice framework are entirely unequipped to handle autonomous digital actors. We building something like that in Docerian, of course. This is an entirely made to design intake patient form and doctor assistant AI. We'll bring you on that. In conclusion, this past week was a true watershed moment for artificial intelligence. The hype is real, and the shift from conventional text bots to autonomous visual and agentic systems will fundamentally restructure the practice of medicine. We're entering a future where AI handles the data, the documentation, and the drudgery, and theoretically freeing up the physician to focus entirely on the patient. But to safely navigate this transition, the medical community must not be passive observers. We must be at the forefront of testing, validating, and regulating these tools. Technology companies are moving at breakneck speed, prioritizing deployment and profits. Of course, there's scale, but in medicine, our first principle remains immutable: do no harm. If you find this deep dive valuable, I want you to go ahead, please subscribe to the channel and share this video with your colleagues, someone who is going to love to have this discussion with us. Let us know in the comments below. Which of these new agentic tools, do you think will have the biggest impact on your clinical practice? Thank you for watching, and I'll see you in the next video. Bye.